You've all seen these kind of costs before. It's no surprise to us that of all the organized countries, we have the highest costs. We know that. It's been going on forever. This slide, though, you might not have seen, amazes me. You take the top 5 industrial nations. Our costs are the same until about age 60. Look what happens to us versus look at the rest of the country. We can explain almost that entire huge difference in healthcare costs on the basis of that alone. Well, I just turned 60, so I'm kind of like looking forward to this, but that is amazing. Look at the difference, and that's, if we want to look at how are we going to most appropriately contain costs, that's the area we got to look at. On the other hand, that's the area of maximum opportunity. And one of the things that strikes me in the urgent care world is, are we doing enough to be attractive to that elderly population? And is that an area of potential opportunity? And good and bad, of course. Here's the rub. I'm going to try this again and see if I learned from my experience. Here's fundamentally why it's so hard to control costs in healthcare. Let's just say right here, these are all the healthcare costs. So we got the doctor costs, the hospital costs, prescription costs, etc. This is too high. We know it's too high. It's got to go from there to there. So it's got to go into that new box. Here is the simple problem in healthcare. It is mathematically impossible for all of those boxes to fit into that second one and be the same size. Simply put, what I'm saying is, any decrease in healthcare expenditures is a pay cut for somebody in the healthcare field. Quick example, 30% of x-rays studies have shown are unnecessary. They're done to CYA or patient convenience or whatever. 30%. So let's say I had some magic wand to reduce health costs by 30%. That's a lot of bucks in that area. 30% x-rays. What would that do to our imaging departments?